Have you been wanting to become more involved with AMSN?
Now is the time, as the AMSN call for volunteers is open.
Help shape the future of our association by volunteering on one of our committees or joining our pool of medical, surgical, nursing subject matter experts. 2 exciting opportunities to grow your leadership skills, connect with peers, and help shape the future of medical surgical nursing.
This year, we're especially excited to welcome new members to the podcast subcommittee, where you can serve as a co-host and help craft the stories and conversations that inspire our community.
Apply now at amsn.org.
Saddle up with AMSN this fall by registering for the 2025 AMSN Convention happening September 11 through 13 in Austin, Texas.
You're in for 3 days of medical surgical excitement.
At the convention, you'll join hundreds of like-minded nurses at enriching educational sessions led by over 80 industry speakers, 11 different networking and meetup opportunities, and so much more.
Elevate your medical surgical practice by joining us in Austin for #AMSN 2025.
Register now at amsn.org/events/AMSN Convention.
On this episode of med-surg Moments,
The yard sale finally came. We did it. The day comes, we set up, and I have to say, in total, that entire weekend,
We're deep in the throes of wedding planning. We've got a venue.
Our topic today is nursing tips for patients with heart failure.
so you're managing a few different systems with that heart failure patient, and at the same time, educating constantly to make those a 1,500 ml restriction. It's hard to impose that on.
I also like to make sure my patients understand
Instead of calling it like a fluid restriction, called it
One of our nurses created a heart failure bundle, and part of that included
Another really, really big thing I noticed is compliance with the heart failure patients. A lot of my
He started drinking from the sink.
this is Mary Tess.
Sam.
Eric.
Marcela.
LA.
and Sydney. Welcome to med-surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud med-surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is nursing tips for patients with heart failure. But before we get started, let's begin with some personal updates. Sam, why don't you get us started?
I would love to. Thank you. We're just having a lot of fun this summer. Theo's running around like crazy. He is just such a ball of energy, and we're having so much fun taking him out and doing fun stuff, going to baseball games, farmers markets, all that kind of stuff. And we've been trying to put some energy into our outside spaces at our house too, just to make sure that we're able to go outside and enjoy the summertime. So that's pretty much what we've been up to the last little bit at home. Marcela, how have you been?
Okay, I know all about that, Sam, chasing little ones. I've got the 1, 3, and 5-year-old, so I'm like chasing too many little ones. And my 15-year-old. People think she's the easy one. She's definitely not. They are all equally a lot to love. That's what they are.
Oh, I love that. That's a lot to love. Yes.
I probably did this to myself on purpose because I just love to stay busy. Because if I'm not busy, then I don't do anything. You know, it's like I have to be one extreme or the other. So I think on my personal updates, the last time the yard sale finally came, we did it. My teenager and I decided to make a giant banner on like a big canvas blanket. It's saying yard sale. It actually came out really pretty. It's my favorite takeaway from this yard sale. We painted it. It's got flowers on it and little doodles. And we put the big banner on front of our house. And we set everything up outside. My mom came over. My brother came over. They set up some stuff. My teenage daughter set up some stuff, and even the little ones were like, I don't need this anymore. I'm going to sell this and I'm going to buy myself a big car. And they're already making plans with their money. So the day comes, we set up, and I have to say in total that entire weekend, less than 15 people. As it turns out, it's a neighborhood yard sale, but our block did not participate. We were the only house on our block. It was the next block over that is very well known for participating. So we did not get a lot of traffic. So it was only a little bit of a bummer. We ordered pizza, we made it a little family gathering party situation. But it was a lot of fun. We made some money. I started also posting on Facebook Marketplace because I had a lot of baby stuff. And that's, for me, is what sold a lot. So we loved it. But now we kind of know what to do for our next one. We need to do a little more PR, signs on the corner, or like posting online. This is going to happen on this day. This is the stuff we're going to have. But it did give us a big boost for ourselves to get the stuff out of the house. I then took anything that we didn't sell to donation. So we got a nice little summer cleaning going on in our house. And then for professional update, I think the last time we talked, I coincidentally had an old best friend from my pulmonary step-down days that was on a contract at my current hospital. So it was pretty awesome. The first time that she worked and I worked on a Saturday together, I was actually placed, because I'm float pool, I was placed on the same floor as her. So not the same unit, but just down the hall. So that first day, anytime we got a little 5-minute break, we got to do some chatting, catching up. And since then, we're still meeting up for lunch and I'm loving it. Sydney, what's new with you?
Not much. I'm so glad to hear your yard sale went pretty good, or at least was a good excuse to clean out your house. I love
Exactly. And a little party.
cleaning, or summer cleaning, I guess now at this point.
Yeah.
The last time we did personal updates, I had just gotten engaged, which now feels forever ago because we're deep in the throes of wedding planning. We've got a venue locked down, which means we have a date. So that's a big stressor off my shoulders of trying to find somewhere to do this thing. And we have a photographer. So next is like a florist and DJ and all the things. But my fiance has 2 older sisters that are both already married. So his mom has been a godsend, helping with looking for venues and mostly timeline. I didn't realize how far in advance you have to do everything. It's not till next fall. So it's like, oh, I have a year and a half. It's fine. She's like, oh my gosh, you need to go dress shopping. And what color dress is your mom going to wear? I'm like, I don't know. We're probably going to go to Macy's. So that's been fun. It's been a really good experience so far. At least hasn't been too stressful. And yeah, it just gets me excited for the next year of all these little like crafts and making it really personalized to us and what we want.
Wedding planning is crazy because there's so much you have to do right at the beginning. And then
Right.
for me, at least, there was like a huge lull in the middle of it. And then it really picked back up in the last couple months.
Yeah, it's like a lot at first, getting everything locked down, then nothing, and then all the little like personal touches.
Mm-hmm.
But I already designed our save the dates because I was procrastinating doing other things.
I love that. Did you do it on Canva?
Oh yeah. Me and Canva are going to be girls by the end of this.
Mm-hmm. Make sure you make a logo too.
Yeah, probably will. Me, TikTok, and Canva are like besties right now.
It was 3 years ago for me and I was in the exact same spot. So here for you across the country if you need anything.
I probably have about like 60 videos saved to a little TikTok folder of like, and it's called Wow, It's My Actual Wedding.
That's awesome.
We'll see what else comes up. I'll probably be insufferable by the end of the year of wedding planning talking as my personal updates. Calais, what's new with you?
Cindy, congratulations. I wasn't able to congratulate you the last time we hit updates. So I'm excited for you. For me, that seems like yesterday, but me and my husband celebrated 11 years. And he actually was heavier than me with the wedding planning. So believe it or not. So for me, some personal updates this summer. My kids are now going to summer camp. We decided to do a church summer camp with their aunt and uncle about an hour and a half away. So they have been loving it. They stay for the week and my husband and I picked them up on the weekend. So they've been loving that, learning a lot about God, learning a lot of arts and crafts. So that's something that's been very good for the summer. My family and I had a great family reunion. It was our first reunion on my grandmother's side that we hosted. And so that was an awesome opportunity to just be with my family. We've had several deaths in the family lately over the past 5 years. And so your reunion was something that was much needed. It was just a blessing to be able to be with my family. We had a barbecue, cookout, field day events. And y'all know I kicked it off with 7:30 a.m. stretch and a run and a walk. We did 2 miles. It was just great to kind of get everyone adrenaline rushing, running. And that was awesome for my family and I. And we ended it with Sunday worship service. So it was just an amazing experience. And for a work update, we are in a new fiscal year. So all of the annual competencies has been turned in. We have new leadership. We have a new manager, which is another exciting thing going on my unit. So I'm very excited to have new management and leadership. So looking forward to all things new.
Calais, speaking of church, I know many moons ago, I told you that I've got a church on the end of our block, and we've been living here 2 years.
Have you been?
Once. Finally, it was a lovely, beautiful, sunny day, and we all got dressed up. My son's little button-down shirt that we never pull out. My kids are just running around wild. So they looked so handsome and pretty, and my daughter got dressed up. It was lovely. It's not even a 5-minute walk to the corner, and they loved it. This church is awesome because it actually has a quiet room with a big window. So I didn't have to worry about the thing that made me most nervous, which was, of course, all the kids not wanting to be quiet and sit still. They have a little basket of books. It worked out great, and they loved it. The only downfall is that you can't hear too well. There's like speakers in there. But they love just as a family doing something together as a routine. So we're going to keep doing it. We like it. So thanks for that push.
Why don't we move on to our topic, nursing tips for patients with heart failure? We all know that caring for patients with heart failure isn't always straightforward, from fluid overload and dehydration to juggling medication management and patient education. We all face challenges riding the line between our clinical skills and compassionate communication. Who would like to get the conversation started?
I think a big part of this is we have to really dive in and get comfortable with policing our patients. It's rough because you just met them and they don't want to hear it. So it's one of those topics with your patient that education and real-time limiting, like, oh, you can only drink this much water today. Who am I to say that you cannot drink water today? I start my shift and I'm counting cups with you. So this is a really interesting topic because you have to get comfortable with being the boss. And also, this is an adult. We're not better than them. We're not their mom, their dad. So to get started on that conversation at the start of your shift, review your orders. Sometimes it's like a 1,500 ml restriction. It's hard to impose that on someone. So I'm interested to see, Calais, what your strategies are, because I know you're always educating your nurses on how to handle these situations.
For me, exercising and dieting is one of the biggest things that I educate my patients about, just because of me doing it. And I live what I talk and educate with my patients. So I give them examples. I tell them I get up and I go for a jog or things like that, but they have to do their exercises that caters to them. They do what their body allows them to do. I also like to make sure my patients understand the why behind why they're doing the things that matters the most. For example, my patient last week, congestive heart failure patient, and she's a caterer. So she cooks a lot of the foods heavy in salts, heavy in fatty greases, heavy in all of that stuff. So I had to have a deep personal conversation with her to say, listen, you have to limit salts when you're eating the food. It's different when you're cooking for large amounts of people, but just be cognizant when you're cooking for yourself, limit the salt intake. Why? You limit the salt intake to prevent fluid buildup, and you limit your salt intake in all your foods. And I try to help her understand grocery shopping is very important. Reading labels is very important. And just getting her to understand the why behind everything that she does to put the pieces together. I also noticed her motivation wasn't there. So it's just giving her a little encouragement. Listen, we can all log our daily weights. We can all log what we're eating. Even log some of the symptoms, signs and symptoms that you're experiencing that comes along with heart failure. And that way you can track how you're feeling. What did you eat this day? It could probably link back to why you felt this way. What did you eat? Limiting what you're eating and doing to kind of get a hold of why something exacerbates or not. So that's just something that I really do to encourage my patients on their journey of having congestive heart failure, any type of heart disease.
Yeah, when you get that heart failure admission, it's usually they come in, their legs are huge, the swelling, and it's uncomfortable. So they're coming in with a few different things. It's hard to breathe when we're walking, shortness of breath. You've got swelling all throughout. I think it's hard for them in their daily life to connect my diet with how my heart is working, with how does this relate to how I breathe? We know automatically why you can't breathe because fluid doesn't just go to one place. And so it's hard for you to breathe because the fluid is all over your body. It's harder for you to take those deep breaths. So you're managing a few different systems with that heart failure patient and at the same time educating constantly to make those connections for them.
Yeah, I wanted to circle back to what Marcela was talking about with policing the patients and all that kind of stuff. A tip that I learned a really long time ago, and it was somewhere on the internet. I don't remember if it was on Twitter or what, but a nurse was sharing that she, instead of calling it like a fluid restriction, called it a fluid allowance. And that sort of just small shift in the verbiage was really helpful for her and the relationship she had with this patient. And instead of feeling like you're policing, it's like, this is what we have for the day. How do we want to allot it throughout the entire 24 hours before it resets? So I've taken that tip with me forever. And anytime I am chatting with like nurse residents or anybody else about heart failure patients are struggling with, I share that with them as at least a tactic they could try and see, is a patient going to be more amenable to the allowance of fluid that they have ordered by their provider.
That's a really good tip to say a fluid allowance versus restriction, because then it doesn't sound so negative. Like you were saying, policing what they do. It's really important to connect inpatient with outpatient. We talk about this a lot. The major differences, like we can do everything while they're inpatient, but then if they go home and they're not following the education that we gave them while they're inpatient, or they're showing up to outpatient appointments a month later and they've gained 2 pounds or 3 pounds, and to their provider, maybe that won't seem significant because it's only a couple pounds, but we know that that was fluid that was building up. I worked on a cardiology unit a few years ago, so we had tons of heart failure patients, and one of our nurses created a heart failure bundle, and part of that included reaching out to our cardiology outpatient and making sure that they had a follow-up scheduled before they discharged. And then she actually worked closely with our outpatient clinic to set up phone calls for afterwards. Not that the patient had to come back for an appointment, but just calling and saying, hey, have you weighed yourself in the last couple days? Have you taken your medications? And just making sure that they were remembering and keeping up with those steps that we always are ingraining when they're inpatient, but then they might not keep up with when they're home.
Yeah, our clinic system, we have a team of nurse navigators specifically for heart failure, and they're doing a lot of that work that you were just describing. And so I think some work's actually being done currently to help kind of streamline things between inpatient and outpatient, just to make sure everybody's on the same page. But it's a lot of those same things: daily weights, checking on their meds, how are they handling those? Do they have access to their meds? All those kinds of things that are so important.
That's a really good point too, Sydney, with the follow-ups that you all have. That's amazing, because a lot of that follow-up can be simple reminders just to remind patients and family members, hey, did you log this? Did you log that? Another really big thing I notice is compliance with the heart failure patients. A lot of my heart failure patients, when they feel like they have to get up to pee, it's the getting up at night for me. It's the getting up in the middle of the night. And I'm like, listen, you have to start being creative with how they're using the restroom at home. And have y'all heard of at-home Purewicks?
Yes.
What do y'all think about that? The Purewicks at home.
I had a patient, she loved calling it the blue hot dog. It is the shape of a hot dog. I believe it's across the board, right? That's just like the brand.
Yeah.
And you put it between your legs, you connect it to suction, and it has an absorbent portion. Some units don't allow it. Sometimes it's only like critical ICU units. But I feel like you're saying, it's handy for someone who's diuresing. I mean, they're going to be peeing a lot and they might not be able to walk, and you can't do a full transfer every time you got to go to the bathroom. So it's connected to suction and it scoops it right up.
That's one of the biggest things, is people don't take their meds because they don't like that they have to go to the bathroom so much, especially at night. I feel like that's one of the biggest reasons that patients or even caregivers that are maybe caring for someone that has heart failure. And I hate to say it, but it happens and it's sad. Caregivers withholding medications, even if it's just that dose at night, so that they're potentially not having to change wet diapers or get up in the middle of the night to take older adults to the bathroom. So if there's tools that people can use at home so that they're not having to get up at night or just stay compliant with their meds, I'm all for it.
On the unit, when you're getting report, it's kind of rough because let's say there is a fluid restriction. They haven't really charted how much the person has already had or not had. And then you have to be the one that goes in and then the patient's like, well, the other nurse didn't say anything about this. You never want to talk down like the person you're handing off with or getting report from. But I like to do, like you said, talk about the log, and I do it right there on the whiteboard. I say, okay, this is what we have to start with. Let's work on this together. I like to put the numbers on a cup and only do like a cup at a time, just so that the temptation isn't there too. And then you drink your whole pitcher of water, little things like that. It's just like visual reminders. I know for me, visual stuff is so helpful. So I'm like, a cup is usually 300. I'll also let them know a Jello is this much, a cup is this much. But I remember we had one patient, he started drinking from the sink, like mouth from the sink. I'm like, you don't have to do that. If you want to tell me no, I will just let the team know, I don't want you at the sink drinking from the faucet. I will give you a cup. This is not jail. But you do have to get into like a little groove with your patient and become a team instead of just you telling them what to do, for sure.
At my old hospital, we had sheets that had pictures of all of our different drinks that we had available with how many milliliters it was. So it was like, all right, this apple juice is, and it was exactly the kinds that we had, is this many milliliters. And we could give it to the patients and say, like, what you're asking for, this is how much it is. And we're going to have to add these up. And once you get to your amount, we're going to have to slow down. One nursing tip that a preceptor taught me was that ice chips are usually like 50% of what a full thing of water is. So we would give patients a pitcher of ice chips. And then that way they felt like they were drinking, but it would take them longer because the ice needed to melt. And then that way they were getting 500 mLs versus a liter by the time they finished their pitcher.
Yeah, definitely. That's a good one. If you're not drinking as much as you usually do, it's good for your body, but your mouth is still dry. So wetting your whistle with the ice chips for sure helps.
Another tip that I think can be important for folks to know with these patients too is that sometimes their medications can be like a little bit deceiving because there are some meds like beta blockers and other things that they might be on specifically for their heart failure, and it may not be for blood pressure. If you're looking at their meds, I think you might need to be asking those questions too, and just be careful about if there are hold parameters on it or things like that. Make sure you're reading through the cardiology notes, clarifying with the provider if needed, but sometimes those can be a little bit tricky until you get more used to those in your practice. So
that's a really great point, because a lot of the newer nurses, they would say, hey, this blood pressure is low, I held this medication, but they're not understanding the pathophysiology of the medication. If something is constricting the blood vessels or if something is needed for a diuretic or things like that. So that's a really awesome point.
And definitely keep an eye on dizziness, of course, when we're getting up. But if they're on a drip, a diuresing drip of any kind, and I don't see that they're on like a heart monitor, I get nervous for sure, because the fluid fluctuation can hit people so hard, like on their heart rhythms. I'm like, this person definitely needs to be on telemonitoring depending on what they're getting, because it hits each patient a little bit different. I really prefer the heart monitoring when they're on a drip.
yeah, and also electrolyte imbalances too from those diuretics as well. Aggressive diuresis. Gotta watch that potassium really closely.
Yeah, it's definitely possible to over diurese people, especially too quickly.
Well, you guys, believe it or not, we're just about out of time. But before we close, let's go around and have each of you share your biggest takeaway from this conversation.
I would say the biggest takeaway for me is what Sam actually just said, is remembering about the electrolyte imbalances. I think that we get so caught up in the numbers of fluids and I's and O's and all those types of things, but there's so much more that comes into play, especially when we're messing around with fluid balances in the body.
I like the takeaway of connecting it to home, their home life, because you're only with them for a fraction of what they're going through, and making sure that they know how to translate this tracking at home. I think that's a really important conversation that gets missed sometimes.
Yes, that's exactly what I was just going to say as well. Like, we have to be able to make sure using that teach back method or something to ensure that they're picking up what we've been teaching them and that they're going to be able to translate that at home. That's a big deal for sure.
Otherwise, they're going to be right back in our emergency room.
For me, the biggest takeaway would be what Sydney mentioned about outpatient follow-ups and things like that, making sure your patients understand to follow up with their cardiologists, follow up with their primary care providers, doing their logs and their due diligence to make sure that they are following their medication regimens, their exercising and dieting, and just keeping up with their care as well at home. To our listeners, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of med-surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to med-surg Moments wherever you listen to podcasts.
To reach us, use hashtag med-surg-moments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We are all AMSN members, and if you love med-surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the med-surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Mary Tess,
Sam,
Calais.
Marcela.
And Sydney. And always remember, med-surg Moments is a moment in our lives and a moment in our med-surg careers that makes a huge difference.